Thank you for taking the time to learn more about your CT-guided lung biopsy procedure. I hope this information will help you understand it more and relax if you are nervous. CT-guided lung biopsy is a common procedure that we do at Mayo Clinic Health System, and we will take good care of you. First, let me explain what CT or CAT scan is. It is an imaging test that uses a unique machine that lets us, a special type of doctor called a radiologist, to look inside of your body. If you were referred to interventional radiology to be evaluated for CT-guided lung biopsy, chances are you have already had one or more CT scans. We will use the CAT scan to determine if it is safe to do the procedure, and if it is safe, to plan the best route. Simply, a biopsy is taking a sample of your lung tissue so it can be tested. While different kinds of doctors perform biopsies, radiologists do what are called image-guided percutaneous biopsies. That means we go through the skin with a small needle, and using the CAT scan, we guide the needle to the middle of the area we want to sample. As I said earlier, you more than likely have had a CAT scan of your chest that shows some abnormality. We need a sample of tissue so that we can make a diagnosis and determine the best treatment for you. Just because we are doing a biopsy does not mean that you have cancer. Many types of diseases and conditions look the same on a CAT scan, such as pneumonia and other non-cancerous diseases. That's why we need to take a sample, to give us more information so we can determine what it is and the best way to treat you. First, you will be evaluated in the clinic by an interventional radiologist who specializes in these types of procedures. We need to determine if the procedure is right for you. If we can find a safe path to your lesion through your skin, then you will be scheduled for a CT-guided lung biopsy. You will be asked if you are taking any blood thinner medication. The day of your procedure, we will do another CAT scan of your chest to see if the lesion has changed any since the previous scan. If it has, we may decide not to do the biopsy based on this first CT scan. Remember when I said that just because we see a mass on the CAT scan does not mean that you have cancer? I wasn't joking. Sometimes something as simple as pneumonia may look like cancer on a CT scan, and if the lesion that we're going to biopsy has gotten smaller, we'll probably not perform the procedure and instead may suggest that you have a follow-up CT scan in 1 to 3 months to see if the lesion has gone away completely. If the lesion is the same as our first CT scan, we will start to get you ready for your biopsy. To do this, a radiology technologist will position you on a cushioned table. You may need to lie in a specific position on that table for an hour or more. We will use a series of short CAT scans to pick a good spot in your skin to get to the lesion. Once we have our spot picked out, we will give you medications to help you relax during the procedure. These two drugs are called Versed and fentanyl, which will make you sleepy but will not put you completely to sleep. Then we will clean off your skin and give you a numbing medication underneath the skin at the biopsy site. Next, we will insert a small needle into the lung using a series of very short CAT scans to guide us from your skin to the spot in your lung. This part is very important. The radiologist will give you some specific breathing instructions. Not following these breathing instructions will make the procedure last longer and increase your risk of complications. This brief video will help explain why.
As you breathe, some of your organs shift in your body. The target area moves with them. But when you hold your breath and lie still on the table, the target area doesn't move. That's why you'll be asked to take and hold a breath a number of times during the procedure.
After we take the sample, we send it to the pathology lab to be analyzed. After we take our samples, we take one more CAT scan to see if everything is okay. Next, you will go to the recovery room for a few hours. For most cases, we do not use general anesthesia for this procedure. You will not be put to sleep. What most people don't realize is that while general anesthesia is safe, it is significantly more risky than the CT-guided lung biopsy procedure itself. One goal of this procedure is to avoid the general anesthesia required for an open surgical biopsy. Again, you will receive medication that will help you relax during this procedure. The two drugs, Versed and fentanyl, will make you sleepy but will not put you completely to sleep. Typically, you will be able to go home the same day as your procedure. You will, however, need someone to drive you home after the procedure because of the medications we gave you. First, again, let me reassure you, this is a safe procedure that we do all the time. There is a minor risk of infection, bleeding, and pneumothorax. There's also the possibility that the test may not give us an answer. A small amount of bleeding is normal, and you may have a cough with a small amount of blood in your phlegm after the procedure. If you are coughing up large amounts of blood, and this is concerning to you, you should go to the emergency department. There are a few things that can increase your chance of bleeding, including the use of blood thinners like aspirin or Coumadin before your procedure. At your clinic visit before your CT-guided lung biopsy, the radiologist will direct you to stop any and all blood thinners before the procedure. If you remember only one thing from this video, remember this. If you are taking any blood thinners, please let the radiologist know. Pneumothorax is a medical term for air around the lungs. Air should be in your lungs and not around your lungs. Pneumothorax occasionally develops with this procedure. If you experience a small pneumothorax, we'll take a chest x-ray and monitor you for a few hours after the procedure to see if it gets larger. If you develop a larger amount of air around your lung, we may have to place a tube in your chest that will draw out the air and keep your lung from collapsing. If you have a large pneumothorax, we can place the chest tube immediately on the CT scan table. If we have to place a chest tube, you will be admitted overnight for observation and to make sure that your lungs fully expand before we send you home. The risk of pneumothorax depends on a few things, like how good your lung tissue is and where the abnormality is located within your lung. The radiologists will discuss your risk for pneumothorax with you when you come for your clinic visit before your procedure. It's important to remember these final tips before your procedure. Tell your radiologist if you've taken any blood thinners in the past 7 days before your biopsy. Tell someone if you have trouble lying flat for a long time. Make plans to have someone drive you home after your procedure. And remember, relax. This is a safe procedure and will get us one step closer to an answer and getting the right treatment for you. Thank you, and please let us know if you have any questions or concerns before your procedure.